Doctors have warned of picket lines outside NHS hospitals this winter as they demand a 30% pay rise to avoid strike action. The BMA, the British Medical Association, pledged to lobby ministers for the pay rise yesterday as delegates at the union's annual conference clapped and cheered in support of industrial action. Doctors passed a proposal calling for a steep pay increase after being told, vote for this motion and I'll see you on the picket line. Some doctors who supported the motion pointed to the rail workers' strike as inspiration for how public sector workers should pursue pay demands with the current government. Dr Bob Gill is an NHS family doctor. Afternoon to you, Bob.
Afternoon, Ian.
Good to have you. You haven't got I was expecting you with a placard in your hand or something, standing there talking to me this afternoon, but not quite.
Not yet. We're not there yet.
30% pay rise. I mean, there'll be a lot of people listening to this thinking, hang on a second, you're all doctors. You know, you're paid rather well for your impressive services, but 30%?
Well, what we need to consider is what's happened over the preceding decade. Since 2008, we've had an austerity policies with public services. What the doctors are asking for is pay restoration, get us back to where we would have been had there not been the self-destructive austerity policies of the last decade. So it's a restoration of where they would have been.
There will be a lot of people, of course, in a similar boat who are saying, yeah, I mean, you know, in theory, on paper, notionally, that does make sense. But we all know in reality, there's no way that the Treasury can cough up a 30% pay rise for people already earning a pretty impressive salary. I know some junior doctors, 29,000, I keep hearing that figure. But, but your average doctor on 70, 80,000 quid, then 30% of that is just not doable across the board, is it?
Well, I think the application is to restore predominantly junior doctors, hospital doctors' pay back to where it would have been had we not had austerity. What we also see is people's costs of living have gone up. That applies to doctors just as much as everybody else. Mm-hmm. But let's not forget the government does have a magic money tree, which it brought into use for the pandemic. We spent 37 billion with a catastrophic pandemic response, which failed to prevent the lockdowns. Economic consequences we are still feeling. Yeah. So when the government politically wants to spend money, it will do. The problem we're not highlighting here is why has there been wage suppression of key public service workers? Is because this is part of a privatization plan, and getting the wage bill down is more attractive to future investors like corporations who will be increasingly taking over NHS functions.
I'm bound to ask, I mean, that's a whole separate debate about privatisation, but what is the specific evidence for that? Because as far as I can ascertain, the Tories have been accused of wanting to privatise the NHS since 1948, and we haven't seen a lot of evidence of it. Some services, of course, are farmed out, but broadly speaking, the idea of a seismic industrial scale privatisation is not, I haven't seen it on the cards anywhere. Perhaps you have, Bob.
Yeah, well, they wouldn't do a seismic privatization because it would be deeply unpopular. So they set about it by stealth. You mentioned outsourcing. Outsourcing is a form of privatization. Our railways are privatized. The public and the passengers subsidize the profit of foreign state-owned corporations. You couldn't make it up. What's happened to the NHS is we have more than 50% of routine hip replacements being done by the private sector. In fact, during the pandemic, when these private hospitals would have collapsed, the public bailed them out. The public paid through the nose for private bed capacity, which we didn't use. At the same time, over the last decade, we've lost 20,000 NHS beds. That is another form of privatization.
But of course, that also
NHS capacity. Where do people have to go?
But that also happened in 1997, didn't it, under Tony Blair, when people were having specifically things like knee and hip operations in independent private sector treatment centres, I think they were called, which was essentially private healthcare.
Exactly, absolutely. This is not party political. You have an alignment. Our politicians are in agreement. It's just that they're not telling the public, and it's not in the public interest. When it comes to healthcare, universal comprehensive provision provided by highly qualified, well-treated staff is the key. But this is not the direction of travel the government are taking. The government's successive governments are copying the American system, which will be a state-funded skid row service and a expanding private market. Nobody voted for that.
So much like other countries in Europe in that respect.
No, other countries in Europe have a Bismarck system, which is employer-based insurance, and they have state-subsidized provision as well.
But what is the evidence, Bob, for specifically in America? Because everybody always jumps and says, oh, it's the American model, because we all have this terrible image of the American model being hugely expensive. But of course, as you know, there are dozens of healthcare models around the world. Why do you suspect the American model?
I don't suspect. There's plenty of evidence. So the chief executive of NHS England from 2014 to 2021 was a Mr. Simon Stevens, who came from United Health, America's biggest insurer. He has instituted change on the NHS along the lines of a private insurance model. Only last week, United Health bought out the biggest GP patient electronic record system at the cost of $1.5 billion, only last week. So, to deny the presence and influence of the American insurance industry and American providers is to ignore the evidence. Boris Johnson's health advisor is also from an American insurer called Centene. Centene was the subject of a panorama 2-3 weeks ago.
Yeah, I saw that.
Centene is now the biggest provider of GP services funded by the taxpayer, and they provide an appalling service. So the evidence of privatization is in abundance. Will there ever be an open political discussion about this? Absolutely not, because they know it is politically suicidal.
Well, there is. There are many people. I can hear some people screaming at their radios going, well, hang on a sec, the NHS does need to change badly. Whether that is the way to change it is another debate. But it seems there are kind of two things going on here. There's obviously the pay issue, and then there's the disgruntlement about the future of our health service. Just a final point, Bob, are you willing then to down stethoscopes and literally stand on a picket line, not go to work and fight for a 30% pay rise?
I think all steps will be taken to maintain emergency cover for hospitals, but the government has left the profession no alternative. It's good to see at last the BMA doing the right thing, because they actually undermined previous industrial action. But it sounds like the new membership of the BMA representative body is prepared to take action. That is well overdue.
What do you say to, just a word finally, Bob, there might be some of your patients listening to this. What do you say to them who need a face-to-face with you, who need treatment, who need to get advice from you? What do you say to them on that day that you might be striking?
I say either you support us with our fight for your future safe patient services, which are run by well-educated, well-qualified, well-supported professionals, or you sit back, criticise us, and watch the gradual demise of the NHS.
OK, Bob Gill, thank you. Dr Bob Gill, NHS family doctor, response for that. I think conflating 2 points there, but I'll leave that to you to respond to. This is Talk TV.